Today we discuss reproductive health. RCH stands for Reproduction and Child Health Care Program. In 1951, Indian government introduced family planning program. So they modified this program as Reproduction and Child Health Care Program. So answer is 4. Next question is, growth rate of Indian population according to 2001 census report is 17 births per 1000 human beings. So growth rate is 1.7. In developed countries, growth rate is 0.3 or 0.4. With the same growth rate, Indian population double within 33 years. So growth rate of Indian population according to 2001 census report is 17 per 1000 human being per year. So at this rate, the human population double within 33 years. Next question. Find out the correct statement regarding contraception. Pills have to be taken daily for a period of 21 days. So 21 days from 5th to 25th day in every menstrual cycle. They should take 21 days from 5th to 25th day. And so they should not take pill next 7 days. Next 7 days means 26, 27, 28, 1, 2, 3, 4. Last 3 days of that menstrual cycle, next 4 days of, so first 4 days of next menstrual cycle. So that means every month they should take pill from 5th day to 25th day. So that is correct only. Saheli is a once a week pill with very few side effects and high contraceptive value. So that is also correct. Saheli is developed by Central Drug Research Institute located at Lucknow. Third one, sterilization procedure in the male is called tubectomy. So wrong. Vasectomy. Lippis loop is a hormone releasing IUD. Lippis loop is a non-medicated, non-hormonal IUDs. So that's why 1 and 2 correct. D option is correct. So next one is, how do the pills work? Actually, except Saheli, all pills, except Saheli, all pills, all implants and hormonal IUDs. So they contain progesterone or estrogen combination. So in the body, progesterone level, only progesterone or sometimes progesterone estrogen levels are more. So these hormones fool the body. The body think ovulation completed, but no ovulation. So they avoid ovulation. If no ovulation, secondary oocyte is not released. If secondary oocyte is not released, automatically no implantation. Similarly, cervical mucus become thick, so no implantation. So mainly the pills, implants and hormonal IUDs prevent ovulation. So if no ovulation, automatically avoid implantation. So that's why inhibit ovulation and implantation correct. Alter the quality of cervical mucus to prevent or retard the entry of sperm also correct. So third option, prevent the ejaculatory semen from enter into the female vagina, wrong. Inhibit spermatogenesis, wrong. Only 1 and 2. So B option. You should remember, except Saheli, all pills, all implants, hormonal IUDs, avoid ovulation, avoid implantation, and mucous membrane become thick. In case of Saheli avoid implantation only. Fertilization occur, avoid the implantation. In case of barriers, condoms, diaphragm, cervical caps, prevent the fertilization. The sperm unable to reach the ampulla. Prevent the fertilization. In case of barriers, condoms, diaphragms, cervical caps, walls, all prevent fertilization. Next question. Which of the following statements are correct regarding surgical method of contraception? Which of the following statements are correct regarding surgical method of contraception? These are generally advised to the male or female partner as a terminal method, final method, once they don't want further child. So, at the time, as a terminal method. Correct only. Surgical procedure in male is called tubectomy. Wrong. Reversibility is easily possible. It is irreversible. Once they perform sterilization process, reversibility, so not possible. So reversibility is easily possible. Wrong. So they block gamete transport and thereby prevent conception. Correct. So 1 and 4. Answer is C. Select the correct statements regarding IUDs out of the following. Intrauterine device are the plastic or metal objects which are inserted in the uterus of the female through vagina. So correct only. Which are inserted into the uterus via vagina. Second, IUDs may be categorized as non-medicated IUDs, Lippes loop non-medicated, copper, CUT, CU7, multi-loaded 375, and hormone-releasing IUDs, Progestocert and LNG. Correct. In India, use of IUD is one of the effective and popular methods. So, Indian women opt IUD. Most of the Indian women opt IUDs as a contraceptive method. So, all are correct. All are correct. Next question. Statement 1. CUT, CU7 and multi-loaded 375 are the hormone releasing IUDs. So, wrong. Statement 2. Cu ions released by some IUDs affect the ability of uterine wall to support embryo, thus cause contraception. So, if they support embryo, how it used as a contraception? So, wrong. Both the statements are wrong. Answer D. Match the following. Removal of small part of fallopian tube. Removal of small part of the fallopian tube is known as tubectomy. Next one. Removal of small part of vas deferens, vasectomy. Next one, fusion of gametes within the female. Within the female is known as in vivo. Fusion of gametes outside the body, in vitro. In vitro means laboratory. Fusion within the female, in vivo. Within the body, in vivo. Outside the body means in the laboratory, in vitro fertilization. So answer is C. Increased IMR and decreased MMR. IMR means infant mortality rate and decreased maternal mortality rate in a population will not cause significant change in growth rate. Why? Decreased maternal mortality rate, no harm to mother. So increased infant mortality rate. So generally not cause significant change in the growth rate. Intensely lactating mother do not generally conceive due to the suppression of gonadotropin, FSH and LH not released. In the absence of FSH and LH, primary follicle failed to convert it into Graafian follicle, no menstrual cycle. So in the absence of FSH, Graafian follicles not formed, so no ovulation. So that's why that is due to suppression of gonadotropin. Hypersecretion of gonadotropin wrong. Suppression of gametic transport wrong. Suppression of fertilization. So answer is suppression of gonadotropins. Sterilization techniques are generally foolproof methods of concentration with least side effect. Sterilization techniques, foolproof methods of conception with the least side effects. Yet this is the last option for the couple because methods of conception, it is almost irreversible. It is almost irreversible, correct. Of the misconception that will reduce sexual urge. So that is also correct. It is a surgical procedure, correct. So next one is of lack of sufficient facilities in many parts of the country. So correct option is D. All are correct. It is almost irreversible. Misconception that will reduce sexual urge. It is a surgical procedure, correct. Of lack of sufficient facilities in many parts of the country, particularly rural areas. So that's why answer is all statements are correct. Emergency contraceptives are effective if used within 72 hours of coitus. Within 72 hours of coitus only that is effective. Next question. Condoms are one of the most popular. Condoms are one of the most popular contraceptive because of the following reasons. These are effective barrier for insemination. Effective barrier for insemination. So these are effective barrier for insemination. So correct. They do not interfere with coital act. So correct. These help in reducing the risk of STD. Correct. So all statements are correct. So all of the above. Diaphragms are contraceptive device used by the female. So correct. Choose the correct option from the statement given below. They are introduced in the uterus, not in the uterus. So cover the cervix. So wrong. They are placed to cover the cervix region. Correct. They act as physical barriers for sperm entry. That is also correct. They act as a spermicidal agent. Wrong. So 2 and 3. First statement and fourth statement wrong. They are introduced into the uterus. Wrong. They are placed to cover the cervical region. Correct. Similarly, they act as physiological barrier for sperm entry. So option is C. Following statements are given regarding MTP. Medical termination of pregnancy. Choose the correct option given below. MTPs are generally advised during first trimester. First trimester means first 3 months or first 12 weeks. Correct. That is safe. So MTPs are used as contraceptive method. Wrong. MTPs are always surgical. Wrong. Sometimes no need by oral medication or by giving injection also. MTP. So always surgical. Wrong. MTPs require the assistance of qualified medical personnel. Correct. So first trimester correct. MTs. So fourth statement correct. So answer is C. Second, Medical termination of pregnancies are used as a contraceptive method, wrong. MTPs are always surgical, wrong. So that's why answer is C. Next one is in vitro fertilization and embryo transfer technology. Developing embryo is implanted in the fallopian tube, as in the fallopian tube means within 8 cell stage. After 8 cell stage they should inserted into the uterus. That's why 8 cell stage. Up to 8 cell stage they may transfer to fallopian tube. After 8 cell stage into the uterus. So in vitro fertilization, embryo transfer, so up to 8 cell stage. Embryo transfer technology. Embryo is implanted in the fallopian tube 8 cell stage. Answer is B. When it become 32 cell stage, so at 32 cell stage they should implanted into the uterus only. Next question. Surrogate mother is mother without lactation, wrong. Future mother with embryo implanted from another, or the female act as a mother for ovum of another female, known as surrogate mother or foster mother. So that B. Next one, the test tube program employs which one of the following technique? Intracytoplasmic sperm injection, intrauterine insemination, gamete intrafallopian, that is zygote intrafallopian transfer. Test tube procedure means fertilization in the laboratory. In vitro fertilization, embryo transfer technique, zygote intrafallopian transfer. So here option D. Choose the correct statement regarding the GIFT, zygote intrafallopian transfer procedure. Ova collected from a female donor are transferred to the fallopian tube to facilitate zygote formation, wrong. Zygote is collected from a female donor and transferred to the fallopian tube, so correct. Zygote is collected from female donor and transferred to the uterus, wrong. Ova collected from a female donor are transferred to the uterus. So answer is zygote is collected from a female donor and transferred to the fallopian tube. Choose the correct statement regarding the zygote intrafallopian transfer. Zygote is collected from a female donor. Zygote is collected from a female donor and transferred to the fallopian tube. So in the given options, zygote intrafallopian transfer. Zygote is collected from a female donor and transferred to the fallopian tube. So zygote intrafallopian transfer. Match the following. Genital warts. Genital warts caused by human papilloma virus. A is D. So first one D, genital warts, human papilloma virus. Syphilis, syphilis by Treponema pallidum. So 1, genital warts, human papilloma virus. So second one syphilis, Treponema pallidum. Next one is trichomoniasis. Trichomoniasis is a protozoan. Trichomonas vaginalis cause the trichomoniasis. Chlamydiasis. So next one, fourth is A, option B. You should remember genital warts, HIV, hepatitis B. These three STDs are not completely curable. The remaining STDs or venereal diseases are completely curable. Genital warts, HIV, hepatitis B. So answer is B. Next one is choose the right one among the statement given below. IUDs are generally inserted by the user herself. Wrong. So doctor or skilled nurse only insert. IUDs increase phagocytosis reaction in the uterus. Correct. All IUDs. So phagocytosis, they destroy the spermatozoa. So correct only. IUDs suppress gametogenesis. Wrong. IUDs once inserted need not be replaced. Long. So maybe 5 or 7 years. Inserted by herself. Wrong. So only B answer. IUDs increase phagocytosis reaction in the uterus. Intrauterine devices. So in India, most of the female opt this contraceptive method. Condoms are one of the most popular contraceptive because of the following reason. They are effective barrier for insemination. Correct. They do not interfere with coital act. Correct. These help in reducing the risk of STDs or venereal diseases. So all are correct. So answer is D. Next, from the sexually transmitted diseases mentioned below, identify the one which does not specifically affect the sex organs. Syphilis, sex organs. Gonorrhea, sex organ. Genital warts. Answer is AIDS. It never affects the sex organ. AIDS attack the host cells, contain CD4 markers and destroy only T helper cells. So in this manner, AIDS exhibit tissue trophism. What is the tissue trophism? If the pathogen destroy a particular cell or particular organ, it is known as tissue trophism. Which of the following is hormone releasing IUD? CU7, multi-loaded 375. Both are copper IUDs. Lippis loop, non-medicated IUDs. LNG20, progestosert are the hormone releasing IUDs. So LNG20. Next question is, which of the following is incorrect regarding vasectomy? Irreversible sterility. So it is not. So irreversible sterility correct. So it is not possible for reversibility. So one man after vasectomy again change mind. So he wants children. So it is not possible. So irreversible sterility correct only. No sperm occur in seminal fluid. So which of the following is incorrect? So first one correct. No sperm occur in seminal fluid also correct. No sperm occur in epididymis wrong. So the wrong statement is in epididymis. In examination, so these type of questions are important. So correct options okay. You first underline the incorrect. Later you go through the statements. Sometimes what happen? So even though they read it is incorrect statement, after reading they may opt correct statements. So concentration is important. That's why in questions they may give incorrect. First you underline incorrect. Later you go through. So here incorrect one is no sperm occur in epididymis incorrect. So no sperm occur in part of the vas deferens. What is vasectomy? We cut and tie the vas deferens only. That's why answer is, so it is wrong statement. No sperm occur in epididymis. Embryo with more than 16 blastomeres. Embryo with more than 16 blastomeres formed due to in vitro fertilization is transferred to, so uterus. More than 8 transfer to uterus only, up to 8 transfer to fallopian tubule. Here given more than 16 blastomere, so compulsory transported to uterus only. In contest on amniocentesis, which of the following statement is incorrect? It can be used for detection of cleft palate. Correct only. Cleft palate is a genetic disorder. So amniocentesis meant for identify the genetic disorders in the not yet born. So correct. It is usually done when a woman is between 14 to 16 weeks pregnant. Identify in contest incorrect statement. So that is correct. So it is also correct. 14 to 16 weeks pregnant. It is used for prenatal sex determination. It is wrong. Some medical practitioner misuse amniocentesis to identify the not yet born baby. But this test not meant for identify the sex of the not yet born baby. This test meant for identify the genetic disorders. That's why answer is C. It can be used for detection of Down syndrome. So Down syndrome also one type of genetic disorder. D genetic disorder, first also genetic disorder. Generally they perform amniocentesis between 14 to 16 weeks pregnant woman. So wrong statement is C. Which of the following approaches does not give the defined action of contraceptive? Does not give the defined action of contraceptives. Vasectomy prevent spermatogenesis. So wrong. Vasectomy never prevents spermatogenesis. Barrier method prevent fertilization. So correct only. Intrauterine devices increase phagocytosis of sperms, suppress sperm motility and fertilization capacity of sperm. That is also correct. So hormonal contraceptive prevent retard entry of sperm, prevent ovulation and fertilization, prevent entry of sperm. So that is wrong. So hormonal contraceptives. What is the function of hormonal contraceptives? Prevent the release of ovum, not entry of sperm. That's why D is incorrect. Which of the following approach does not give the defined action of contraceptive? So answer is D. Next question. A childless couple can be assisted to have a child through a technique called GIFT, gamete intrafallopian transfer. So full form is gamete intrafallopian transfer. In this technique, they collect the gamete from the donor and inserted into the fallopian tubule of the wife. So fertilization in the fallopian tubule, later implantation, give birth to young one. So the children developed by gamete intrafallopian transfer contain 50% genes of the male parent and 50% genes of the donor. So gamete intrafallopian transfer. So next question is which of the following viruses is not transferred through semen of an infected male? So that is chikungunya. Chikungunya transfer from one person to another person through the bite of Aedes mosquito. Aedes mosquito is a diurnal mosquito. The remaining are transmitted through semen, sexual contact, Ebola virus, hepatitis B virus, human immunodeficiency virus. So answer is chikungunya virus. Next question is which of the following is not a sexually transmitted diseases? So trichomoniasis is caused by Trichomonas vaginalis, present in the vagina. So that is a sexually transmitted disease. Syphilis, sexually transmitted disease. Treponema pallidum causes syphilis. Acquired immunodeficiency syndrome caused by human immunodeficiency virus. So encephalitis, brain fever is not a sexually transmitted disease. Encephalitis. So next question is assisted reproductive technology IVF involves transfer of zygote, ovum into the fallopian tube, wrong. Zygote into the fallopian tube, okay. Zygote into the uterus, wrong. Embryo with 16 blastomeres into the fallopian tube. So zygote into the fallopian tube. In vitro fertilization, embryo with 16 blastomeres into the fallopian tube, wrong. So answer is 2. So 8 cell stays into the fallopian tubule. After 8 cell, up to 32 cell transfer to uterus. Which of the following is a hormone releasing intrauterine device? That is LNG. LNG-20 is a hormone releasing intrauterine device. Tubectomy is a method of sterilization in which a small part of the fallopian tubule is removed or tied up. Correct. Ovaries are removed surgically. So wrong. Small part of vas deferens is removed or tied up. Uterus is removed. So hysterectomy, that is. So answer is small part of the fallopian tube is removed or tied up. So in tubectomy. Sterilization in female is known as tubectomy. Artificial insemination means artificial introduction of sperms of a healthy donor into the vagina. So correct. Introduction of sperms of a healthy donor directly into the ovary, wrong. Transfer of sperms of a healthy donor to a test tube containing ova, wrong. Transfer of sperms of husband to a test tube containing ova. So answer is introduction of sperms of a healthy donor directly into the ovary. You should remember gift. Gamete intrafallopian transfer is defect in the female partner. At the time they opt gift. If defect in the male partner, artificial insemination, intracytoplasmic sperm injection. So these methods opt if defect in male partner. IVF, ET, in vitro fertilization, embryo transfer, or zygote intrafallopian transfer. So defect may be either male or female partner. So gift means defect in female partner only. Artificial insemination or ICSI. If any couple opt for artificial insemination, ICSI means defect in male partner. So next question is, one of the legal methods of birth control is by having coitus at the time of daybreak, by a premature ejaculation during coitus, abortion by taking an appropriate medicine. So that is correct. Abortion is legalized in India in 1971. So that is the legal by abstaining from coitus from day 10 to 17th of the menstrual cycle. So answer is abortion by taking an appropriate medicine is the legal method in the given options. Which of the following cannot be detected in a developing fetus by amniocentesis? Down syndrome, genetic disorder. Klinefelter, genetic disorder. So the amniocentesis is not meant for identify the sex, but by using amniocentesis, some medical practitioners misuse to identify the sex of the fetus. So they are unable to identify jaundice. So jaundice is the symptom of inflammation of liver. Hepatitis symptom. Inflammation of liver is known as hepatitis. Inflammation of liver is known as hepatitis. Hepatitis symptom is jaundice. The technique called gamete intrafallopian transfer is recommended for those female who cannot produce an ovum, correct? Who cannot retain the fetus inside the uterus. She is unable to produce ovum, but the internal environment suitable for implantation, gestation. So she can give birth to young one. So defect only, she failed to release the gamete. So first option. Whose cervical canal is too narrow to allow passage for the sperm? Wrong. Who cannot provide suitable environment for fertilization? Only option is fail to produce ova. So answer is A. Medical termination of pregnancy is considered safe up to how many weeks of pregnancy? 12 weeks or first trimester, first 3 months of pregnancy. In some legal cases, they do MTPs in second trimester also. So that is with the permission of the government. Generally, it is safe first trimester only, first 3 months or first 12 weeks. Which one of the following is the most widely accepted method of contraception in India? Cervical caps, tubectomy, diaphragm. So that is intrauterine device is the most acceptable method. Cu, copper ions released from copper releasing intrauterine devices make uterus unsuitable for implantation, increase phagocytosis of sperm, suppress sperm motility. Cu ions released from copper releasing intrauterine devices prevent ovulation. Wrong. Suppress sperm motility. Correct. Increase phagocytosis of sperm. So finally suppress sperm motility. So make uterus unsuitable for implantation. Make uterus unsuitable for implantation. Increase phagocytosis of sperm, suppress sperm motility. So all IUDs phagocytosis. What is the use of Cu ions? Cu ions suppress the sperm motility. Cu ions suppress the sperm motility. In this manner, prevent fertilization. What about phagocytosis of sperm? That is the character of all types of IUDs. Here question is copper ion released from copper releasing intrauterine devices suppress sperm motility. The permissible amniocentesis is for use of the technique detecting sex of the unborn fetus. Wrong. Artificial insemination. Wrong. Transfer of embryo. Wrong. So answer is detecting any genetic abnormality. So they banned this technique to detect the sex of the unborn fetus. Till today, the medical practitioner use amniocentesis to detect any genetic abnormality. To detect the sex of the not yet born baby is banned. So to detect the sex of the unborn fetus, amniocentesis technique is banned. In vitro fertilization is a technique that involves a transfer of which one of the following into the fallopian tube? Embryo only. In vitro fertilization is a technique that involves transfer of which one of the following into the embryo only up to 8 cell stage, either zygote or early embryo up to 8 cell stage, embryo of 32 cell stage. So zygote. So embryo up to 8 cell stage, they never insert the zygote. So zygote undergo cleavage in the laboratory. Undergo division. Cleavage means division of the zygote. So zygote converted into embryo. So they insert embryo only. That is also up to 8 cell stage. Next question is, what is true about the isolated small tribal population related to evolution? So you already know what is founder effect. Founder's effect. Founder's effect. For example, a group of rabbits. We assume 40 rabbits. 4 rabbits contain long limb. these 4 rabbits feel they are superior, so they separated, set up a colony. Now the long-limbed rabbits are known as founders, and now the long-limbed rabbits geographically isolated from the original population. From the 4 long-limbed rabbits, a new population is evolved. The new population contain long limbs like founders, and they are genetically differ from the original population. It is known as founders effect. What is founders effect? A small varied group, genetically varied group, isolated from the original population, set up a colony. Now they are known as founders. The founders geographically isolated. From the founders, new population is formed. The new population resemble like founders, not to the original population. It is known as founders effect. Now you read what is true about the isolated small tribal population. Wrestlers who develop strong body muscles in their lifetime pass this character on to their progeny. Wrong. So it is about, so this statement explains the inheritance of acquired characters. Gained characters never inherited to the next generation. Gained character never inherited to next generation. If it is correct, women wear ornaments. To wear ornaments, they bore nose and ear. So if the acquired character inherited to the next generation, so at the time of marriage, they have holes in the nose or ear. So their babies possess, the newly born baby born with holes in ear and nose. So no newborn baby possess holes. It indicates that acquired characters never inherited to next generation. Next one, there is no change in population size as they have a large gene pool. So that is wrong. Why? Isolated small tribal population given. Isolated tribal population, how it possesses a large gene pool. So that is wrong. Third one, there is a decline in population as boys marry girls only from their own tribe. So answer is this one. So they marry among themselves. So they are genetically differ from the original population. In the textbook also we discuss that all red Indians have O positive, homozygous O positive. Example for founders effect. Actually in human beings 8 blood groups. AB positive, A positive, B positive, O positive, O negative, B negative, A negative, AB negative. But in all red Indians only homozygous O positive. So red Indians are native of USA. So they are unable to stay in USA. So they migrated to forest. So in this manner, so human beings never geographically isolated. So they intentionally isolated. Now till today the red Indian men marry the red Indian woman only. So marriages within the tribe. That's why what happened? Decline in population as boys marry girls only from their own tribe. So C is correct. Hereditary diseases like color blindness do not spread in the isolated population. So wrong. How we can say if the males or females are carrier, so that character inherited to their progeny. So only option C. So this is about reproductive health.